Good afternoon, ladies and gentlemen. This is the final session, and my name is Hélène Boisjoli, and it is my pleasure today to chair this session on women empowerment and health, equity, and agency. I'm chairing this session with women who, like myself, were nurtured and valued by their families as well as by their partners in the workplace and at home. Our three speakers, Dr. Matshidiso Rebecca Moeti, Mrs. Karen Linehan, Mrs. Heidemarie Witzorek-Zöll, are engaged in empowering women in the field of health. They have different approaches that complement each other. You will hear the perspectives of a nonprofit organization such as WHO, but also from industry and government. The speakers will, may I have the slides, please? The speakers will talk about the various dimensions of gender equity and access to health and health care. Women, as you know, constitute an army of first-hand unpaid care providers, as well as the largest proportion of paid health professionals. Healthy women, having healthy women, is so important for the survival and health of children, as well as for the quality of life, of the end of life of the elderly. As you know, every day 1,000 women die of the consequences of pregnancy and childbirth. The loss of so many caregivers to AIDS is a disaster. Violence to women is a problem in itself, but its effect on their capacity to care for others is something we have to think about and try to prevent. Here is WHO World Map of Life Expectancy for children born in 2015. The average life expectancy of the world population is 71 years, but this number varies greatly. In Canada, my homeland, life expectancy is 82 years, compared to 66 years in Botswana, where Dr. Moeti was born. Our speakers will therefore address gender as a determinant of health and quality of life worldwide. In my view, education is a very strong determinant. Here is the UNESCO map showing countries by gender difference literacy. Comparing this map to the previous map, you can see that they are almost superimposed, and this illustrates the fact that areas with higher life expectancy generally have higher level of education, and this is also linked to higher income. So this is how we will work this session. Each speaker will give approximately a 12 to 15-minute speech after I have introduced them, and then we will have an open discussion for the audience. I myself have a few questions for them. So let's get started. We will begin with Dr. Matshidiso Rebecca Moeti. She is the first woman WHO Regional Director for Africa. She's a public health veteran with more than 35 years of national and international experience. She joined the WHO Regional Office in Africa in 1999 and has held several senior positions in this organization. She has held many initiatives to prevent HIV/AIDS. Dr. Moeti has a degree in medicine and a master in public health from the Royal Free School of Medicine in London. Please, Dr. Moeti, the floor is now yours. Thank you.
Thank you very much for that introduction. I need to know how I move my slides. This is one. Okay. Thank you. It's a great pleasure for me to be part of this closing session and this very important discussion about the status of women, women's empowerment, and how it relates to health. And I think it's very important that it relates not only to women's health, but to the health of their families, as you have said, and to the economic health of their countries, we're quite certain. These are future healthy women that are going to drive things in Africa. The UN Secretary General has had adopted by countries a global strategy for women's, children's, and adolescent health, which was launched at the same time as the Sustainable Development Goals. And it urges stakeholders to not only ensure that these populations survive, but also that they thrive and that they transform the world. It's also had a special focus on adolescents, which is a group that has been skipped not only by data, but also by attention, concern, and services. We know that women's status is determined by their educational status, as you have said, and also by economic, legal, and political factors and their positions in society. All of these affect their health as well as their rights, the respect of and the fulfillment of their rights. And the indications are that there has been much improvement in the past decades, but that much still remains to be done, as we're going to be hearing today, no doubt, if we're to achieve indeed the Sustainable Development Goals and if women are to be healthy. So how do these changes come about? We know that in the end, it all depends on women having the ability to make decisions and take actions that improve their health and those of their families. And this is influenced by a number of factors. First, at the individual level, women need to have the capacity, the competency, the agency, as people like to say, to influence their own health. But it's also influenced by their relationships within the social sector to other social actors, increasingly among women in coalitions for mutual support through which they negotiate and become agents of change in their communities and in their societies. And so they realize their rights and the security of their livelihoods, because women's health also depends very much on their economic status. At the structural level, women, both individually and collectively, challenge social and cultural norms and legislation and laws and the social order, and that is accepted. And this is how they are able to change their socioeconomic status and influence their health. So we'll just take employment and livelihoods as an example. And we note that despite many efforts, gender gaps still exist even in developed countries between men and women. And this, you can't see the very small print at the bottom there, but the source of some of these ideas, this report, is from the European Parliament, the Directorate General for International Policies, who showed that despite the progress made in such a region, there still are gaps in employment between men and women. So earning differentials between men and women are still fairly significant in most OECD countries and in the European Union. And it is recognized that poverty, gender stereotypes, and institutional culture still have an impact on how women get educated and on the choices that girls make and on the attitudes that they face in getting an education and in getting an effective education. Gender segregation still exists in choosing fields of study. I remember when my daughter, I have two daughters, when my older child was about 13 years old, I was working in UNAIDS in Geneva, and she was attending an international school in Geneva. And I had to talk to her teacher about how she was doing, and he said to me, "She's not a scientist, is she?" She was 13 years old. He had already made the decision that this 13-year-old girl, she's not a scientist, is she? And indeed, she did end up dropping physics despite all my efforts. And I felt very strongly that she faced, in this teacher, at any rate, attitudes that had concluded that this child is not a scientist and she had better find something social to do, or rather. So this is just a personal example which I've kept in my head for many years, having myself been educated as a scientist, that impacted very surprisingly on my own child in a very middle-class family of a professional woman working in the UN. So I think this is just an example of what happens to children all over in many countries, to girls, as they try to navigate the education systems. So these have an impact on their careers in the future, on their collective bargaining for power in the workplace, and also eventually on their ability to work, because they can or may not be able to afford to pay for childcare and pursue their careers in certain ways. I also thought to share with you what the status of young women can do to their health, taking the example of adolescents. I hope you can read these slides. This is a slide that shows the fertility rate in adolescents in African countries, starting with at the bottom, that in Algeria, 4 out of 1,000 girls between the ages of 15 and 19 become pregnant. That's the very bottom of the slide. And in red at the very top is the Central African Republic, where 229 girls out of 1,000 between these ages, 15 to 19, become pregnant. And this is very much related to their socioeconomic status, to whether or not they are poor, whether they are married early. This makes a huge difference. Whether they have little education or are illiterate, and girls in these positions are the most likely to fall pregnant too early. They also have a higher vulnerability to HIV infection. They have limited or no access to sexual and reproductive health services, and they end up dying in larger numbers through pregnancy and childbirth. In emergency situations, the situation is even more acute, because evidence shows that more than 75% of people affected by humanitarian crises are women and children. And we observe that about 60% of all maternal deaths take place in humanitarian situations, at least in the African region, in situations like refugee camps, where the women are even more disadvantaged and vulnerable, and where the level of violence, sexual violence, gender-based violence, which is prevalent in all regions of the world at some level or other, is most acute and is worst in these types of situations, including sexual violence. However, there has been progress in bridging some of these gender gaps. A lot of work has gone into improving the status of women. I think it's women like yourselves, women and men, like the people who are in the audience, and others who have taken a role in improving the status of women, where we're starting to see some progress. We see that gender gaps in employment rates are narrowing as more women enter the labor market, especially in developed countries. We know, of course, that in many developing regions, including in Africa, women, and in developed countries, women work, but this work is uncounted in the labor statistics, and it's also unremunerated. So women do a great deal of work which is not recognized. This also will have an impact on their economic status and eventually on their health. There is continuing, but we have seen improvement in sex disparity in school enrollment, including in the African region, where girls particularly are able to get into primary school. We have been very concerned that girls are not able to finish secondary education and therefore be better placed to have improved careers. However, this is improving. The proportion of women who are finishing primary school education is getting higher. It's very essential that women are in a position to influence policy and decisions in the political sphere at the national level. And this slide shows, and I'm happy to say we have an ex-minister and an ex-parliamentarian of the EU in our panel. This is a slide that shows that progress has been made, but there is still a great deal of work to be done for women to be adequately placed in decision-making legislative roles. We see that globally, though the number of women parliamentarians is rising, men still dominate in this sphere. And between 1997 globally and 2015, the percentage of women parliamentarians has grown from 12% to 23%. It's not stellar. It's not sufficient. And in red at the bottom there, I'm just showing the situation in the African region, where we see that in Comoros currently there is 3% only of women who are parliamentarians. And in Rwanda, which is a bit of an outlier, they have 64% of parliamentarians as women. And in average, in Africa, the change has been from 9% in 1990 to 22% in 2015. So that still needs a great deal of effort until women can bring their voice and their perspective into national decision-making, because it matters to health. I'm just showing in this slide an example of maternal health service access in Senegal. And we see that we know that skilled attendance at birth is one of the most important factors for reducing maternal and neonatal deaths. And looking at the situation in Senegal and actually in Tanzania in 2015, we saw that women who have a good economic status, the richest had a 16-fold higher access to skilled attendance than the poorest. And a 43% higher access was the case if a woman had at least a high school education. So if women have been to school, this improves access to basic services for health. And very worryingly, women who were in a polygamous relationship had a 20 to 25% lower access to effective services. So there's something to do there about women's ability to negotiate and to be able to have access to services. So what is it that needs to be done? Of course, we know that ultimately we are aiming at getting gender equality and empowering all women and girls. We see that countries that invest in girls' education have lower maternal and infant deaths and lower rates of HIV and AIDS and better child nutrition. And every additional year of schooling among young people, for example, in Botswana, was associated with an 8% reduction in the risk of HIV infection. This is a country that has had one of the most severe HIV epidemics in the world and carries a huge burden up to today. And girls with secondary schooling are up to 6 times less likely to marry as children than those who have little or no education. So these factors really do make a huge amount of difference. So investing strongly in the education of girls and ensuring that they stay in school is extremely important as an intervention. We also need to look at the way girls and boys are socialized and find ways in which girls can be empowered so that they feel that they are equal and they take up positions and are helped by their families to make decisions that take them on the path to equality. This is a case also in terms of their education. I think they're giving the example of my daughter's experience with taking up science at school or not. And we need to build, and we are seeing increasingly programs that are aimed at building the resilience and independence of young women and girls, even those in very low socioeconomic status. I was very fascinated to see in one meeting a tape showing young Somali girls growing up in the United Kingdom in what we might regard as very traditional families where women's status is not very high. They were speaking out, they were on the social media about their status as girls and the opportunities that they want to have to be developed into successful women. Countries also need to enforce legislation that empowers women. It's not enough that we socialize them and we support them at the community and family level, and make sure that services for health are equitably distributed, including among the poorest people, and specifically target disempowered and vulnerable groups like women. And particularly, work in emergency situations for the protection of women, both in terms of their health and in terms of their safety. It's very important that accountability and monitoring of progress of empowerment and assessment of the impact of empowerment continues to be made. This means that there is need to improve the data that is available in different countries that differentiates by gender and that is able to see differences in health status and in the other indicators between men and women. Currently, there are gaps here. There is need to improve civil registration systems that form some of the baseline and the denominators for this data, and to conduct more frequent population surveys so that we know what is happening in terms of progress in improving the status and health of women. So to conclude, I'd just like to reiterate again that empowering women will have a positive impact on their own health, but also on their health, the health of their families, of their communities, and the socioeconomic status of their countries, because they make such a tremendous contribution to economies already. However, there is an urgent need to make sure that we do implement. We have a wonderful framework in the Sustainable Development Goals. Although it is challenging, it is multifaceted, but it offers the opportunities to link health with gender equity and the other social determinants of health in ways that will take us beyond what we were able to do in relation to the Millennium Development Goals. So here's an opportunity in which we can take action. And then finally, just to make a plug for the SDG 3, that we work on equity much more strongly than we have done in the past in monitoring what is happening in the health status of girls, women, and men, and according to different socioeconomic groups, and that we work to plug the inequity gaps. I thank you very much.
Our second speaker comes from the industry, and she was trained with a Juris Doctorate. Karen Linehan joined Sanofi in 91 and was appointed Vice President, Legal Affairs and General Counsel in 2007. She also sits on the Executive Committee of Sanofi. Her role covers the entire company's operation, from research and development, industrial affairs, commercial operations, and support functions. Please welcome Karen Linehan.
Thank you very much. Good afternoon, everyone. I'm so pleased to be at the World Health Summit and to be a member of this very distinguished panel. You may ask why a lawyer from the industry is here. The truth is, Sanofi recognizes the key role women play in healthcare, be it as mothers, doctors, healthcare workers, researchers, CEOs, and even general counsels. In the US, we know that 80% of the healthcare decisions in families are made by women, 78% of the healthcare workers are women, and 70% of the caregivers are women. And throughout the world, the statistics are very similar. We could not succeed as an industry without recognizing the foregoing and making it our mission to work with and for women to improve the lives of all. As my panelists will indicate, one of the key themes that we will talk about today, that healthy populations are a foundation for sustainable social, economic, and environmental development, and of course, peace and security. I can think of no better day to be here than October 11th, the International Day of the Girl. Gender-focused health strategies can act as a catalyst for global change in health and social welfare of women and girls. Good health care can lead to overall benefits for society. And I'd like to touch upon a few areas where gender equality can lead to improvements in health and better quality of life for women and their families. Women with better educations, access to health care, and empowerment are more likely to have less children, are more likely to access health care and have control over health resources. They're less likely to suffer domestic violence. Their children are more likely to survive, receive better health care at home, and receive health care when they need it. Healthy women are also able to actively participate in society, to take collective actions to advance their own interest. They are likely to have greater bargaining power and control over resources in the household. Therefore, collaborative action between gender and healthcare can help maximize the gender policies on health and vice versa. Improvements in population health will require a multi-sector investment. This is why you see people here from NGOs, from the public sector, from industry, from academia. We all are working in the best interests of social, environmental, economic determinants that somewhat have slowed down Health Millennium's development goals. Health-enhancing factors including nutrition, education, water, clean air, sanitation, hygiene, and infrastructure are all essential to achieve Sustainable Development Goals. Around 50% of the gains of health of women, children, and adolescents result from investments outside of healthcare. These include interventions and policies in education, nutrition, water, sanitation, labor, and transport. Cross-sector action, such as increasing women's political and economic participation and mitigating and adapting to climate change, also contributes significantly to health outcomes while contributing to benefits across all sectors. For example, India finally eradicated polio when they started to target the causes of diarrhea disease, such as lack of clean water and sanitation, which were preventing and reducing the efficacy of polio vaccinations. Signed in September 2015, the updated UN Global Strategy for Women, Children, and Adolescents' Health sets out the goals, challenges, and approaches needed to achieve the vision by 2030, a world in which every woman, child, and adolescent in every setting realizes their rights to physical and mental health and well-being, has social and economic opportunities, and is able to participate fully in shaping sustainable and prosperous societies. The three objectives are survive, end preventable deaths, thrive, ensure health and well-being, transform, expand enabling environments. If we, together, achieve the goals laid out, it will yield incredible returns. An end to preventable maternal and child and adolescent death and stillborn, at least a 10-fold return on investments through better educational attainments, workforce participation, and social contributions, at least $100 billion in demographic dividends from investments in early childhood and adolescence, health, and environment, a grand convergence in health, giving all women and children an equal chance to survive and thrive. I would like, therefore, to take a few moments to share with you just a few of the examples where we as a company and industry can support these goals. Most of our programs are carried out locally and with partners because we cannot do it alone. According to WHO, and as Dr. Morty mentioned, people have difficulty when they're not able to deliver children in the appropriate settings. 830 people die each day from preventable causes linked to pregnancy or childbirth. 92% of these deaths occur in the world's 73 poorest countries. There are around 350,000 midwives missing in the world. In Africa, still, most women are giving birth alone, and in South Sudan, it's over 90%. Reducing global maternal mortality, and newborn mortality in participation through our foundation known as Sanofi Espoir. For years, we have sponsored Midwives for Life. This initiative aims at better addressing the challenges for women in the delivery setting by providing them safer conditions, holistic approaches to health and development, to network more effectively all health professionals and community workers, to enable all partners to share resources and expertise so as to fight more intelligently for reducing maternal and neonatal mortality. These programs also aim at increasing the number of skills of midwives and by improving their ability to reach those in need. They improve training conditions, they try to retrain them in their jobs, and they assign them to the areas most in need. Since 2010, we have sponsored more than 16 long-term projects. More than 530,000 women have been cared for, and over 2,100 midwives have been trained in Asia, Africa, and Latin America. Specific initiatives are ones like the one in Mauritania, where more than 1,000 healthcare professionals have benefited from new interdisciplinary practice in perinatal care, and nearly 90,000 women and babies have been cared for. In the poorest region of Benin, we sponsored a call to life, using mobile applications to support women's education and empowerment, giving them pregnancy monitoring tools, diagnostic support, and remote consultations provided by experienced midwives. 25,000 women and girls have been sensitized, 6,500 women have been cared for, and 98% of the deliveries have been in healthcare centers to avoid home complications and mortality. Each year, with our partner, we organize awards for these initiatives to recognize the efforts that have been made to reduce maternal and neonatal mortality. 2 awards were given in 2015, 4 in 2014. And all these awards are given, of course, economic recognition, but they also are entitled to participate in Millennia 2025, another foundation we help sponsor, and it aims at going to the largest population possible through mobile dimensions. Another program is done by Merck. It's called Merck for Mothers. They have been working more than 10 years, in particular in India, Senegal, Uganda, and Zambia. These programs include strengthening the facilities, providing care, supporting training for healthcare workers, and improving access of affordable, quality care and modern contraception. There are many ways that the industry supports the objective of ensuring health and well-being. Each large multinational corporation will have a variety of education, patient access programs, and access to healthcare programs. For Sanofi, we focus where we have the expertise, and therefore we do a lot around education, whether it be in disease awareness or education of mothers on the importance of vaccination or prevention of malaria. Through immunization programs, like our partnership with the Bill and Melinda Gates Foundation, we are trying to eradicate polio. We make sure IPV vaccines is available in 73 of the world's poorest countries, and we're still on target to eradicate polio by 2018. It will be only the second disease to be eradicated. Of course, we also have our access to medicine program, such as anti-malaria, neglected diseases like sleeping sickness and leishmania disease. But we focus going beyond just providing drugs to people. We are trying to build capacities. One example, which focused primarily on women, is connecting nurses. There are 20 million nurses worldwide. 88% of them are female. Since 2011, Connecting Nurses has evolved from a nurse-centric project to highlight the nursing profession to a nurse-patient, community-centered, the goal of which is to contribute to patient empowerment and self-management. It is a community resource to help nurses share information and ideas that promote better quality, patient-centric care. It is about supporting empowerment for nurses, for them to innovate, share their projects, and get aid. Internally within Sanofi, more than half of our managers are women. We have 5 women on our board of directors, yet only 1 woman, myself, on the executive committee. We have many programs in place trying to encourage women to stay in the workforce and to go and leap into the next step. We work internally, but we also work externally, and I'm particularly proud of the role we play in Turkey, where only 24% of women enter the workforce outside the home. We are working in partnership with Women Entrepreneurs Association of Turkey, and we have 2 programs, Women Leaders of the Future and Equal Opportunity Model. Sanofi was the first company to get us certified as an equal opportunity model, where our management committee is virtually 50-50, and we are going out and having other companies do the same thing. Future Women Leaders Project was created to ease a young woman's search for employment and strengthen their position in society. Within the scope of this program, more than 400 young women have completed training in career planning, effective communication, utilization of technology for job seeking, CV writing, and the interview process. It's a 4-day program focused on economically underprivileged women. In 2016, at the end of this month, we will host 100 more women in our factory in Ljubljanas to continue this program. Another program, and it a little bit goes in, again, the direction of Dr. Moiti and the conversation her daughter had with his teacher, Johnson & Johnson is supporting advancing women's education in science, technology, engineering, math, and manufacturing. According to the National Science Foundation, females today earn just 19% of the bachelor's degree in engineering and physics, and they make up a mere 18% of the computer science majors. Once in the workforce, women represent just 28% of the science and engineering activities. In light of such statistics, Johnson & Johnson, which relies heavily on people with science and engineering and other technical skills, launched Women in Science, Technology, Engineering, Math, Manufacturing. This is a program geared to help women representation in these fields. This year, for example, they've announced 10 partnerships to increase the number of undergraduate women enrolled in these fields. In conclusion, the question of what advantages gender equality can bring to society should not need to be asked in our day. All reports, statistics, figures have proved that there are only advantages. The question we need to ask today is what, although we have made significant progress, will accelerate the outcomes so that we can achieve the UN goal strategy vision by 2030. The answer is clear. It is not only what we can do, it's what we need to improve the social, environmental, economic, and political determinants. And we need to do this together, public, private, NGO, and each individual commitment. I look forward to discussing this further today with my fellow panelists and you. Thank you.
So our first two panelists have looked at this through the spectacle, I'm an ophthalmologist, of NGOs and industry. Our third speaker, who is very well known here in Germany, has the government experience. Heidemarie Wieczorek-Zöll is currently Vice President of Friends of the Global Fund Europe, but she was Germany's Minister for Economic Cooperation and Development, as well as Governor of the World Bank from 1998 through 2009. She has been a very vocal HIV, AIDS, and women's health advocate throughout her career. She was trained initially as a teacher. That's what brought her to all of this. So she will tell us, in her view, why we should empower women and girls. Thank you.
Thank you very much for having invited me, and I must confess, I have been frequently in Berlin, but it's the first time I participate in this World Health Summit, and I think it's a great thing. Thank you very much, and also thank you for having invited me. I was born in 1942, so I've experienced times during which discrimination against women was still existing practically in all fields in Germany. And what helped us, women at that time, at that age, to overcome this? Access to education and access to using the birth control pill after its provision and availability in Germany. So in the 60s, as girls and women for the first time were empowered to our own sexuality. One of my conclusions is, and I think we've heard that also with the colleagues that have spoken before, empowering women means, first of all, access to education and access to means of family planning to decide on your own sexual rights. And the experience that I've had personally, of course, have made me very sensitive against all forms of discrimination and the treatment of women as if they were inferior. And I sense this feeling wherever I meet it. And during lunchtime we had a discussion, and at that time Elizabeth Blackburn said, there is also in our countries existing an unconscious bias against women, an unconscious bias. So that exists still, and of course, it's one of our tasks to get over this. And for me, it has also made me a strong obligation to do everything to work for gender equality and equality between men and women. And as Minister for Economic Cooperation and Development, I tried to continue this course. It's always where you are, you have to decide and take your responsibility. I raised the number of women in leadership positions within the ministry from 7% to 40%. So it is important that we do not just talk about women, but that women take up their responsibility. And during my tenure, we supported partner countries and specifically non-governmental organizations, specifically women's groups, in empowering women, getting them access to education, to job and credit, to fulfill the Millennium Development Goals. And a very important goal, of course, was and is the access to means of family planning and realizing their sexual and reproductive health rights. Together with my other female development ministers, and it's good, to team in these cases, they called us the Utstein Group, we helped to create a gender action plan in the World Bank to mainstream women's rights and gender equality into the programs. And by the way, it proves to be very helpful that according to German law, the development minister is responsible, not the finance minister, is responsible for the World Bank. So where are we today with all these efforts? Today, it is necessary to remind all political decision makers of the existing international obligations relating to women's rights. The International Conference on Population and Development, 1994 in Cairo, spelled out the sexual and reproductive rights, and still the unmet needs deprive women of the right to make crucial choices about their own bodies and about their future. And to remind, have every person enjoy a satisfying sexual life. Give women the freedom to decide if and when to give birth to a child. Have access to affordable and effective methods of birth control. More than 225 million women have unmet need for modern contraception services. And just across to contraception services could prevent 1 in 3 deaths related to pregnancy and childbirth. And we've heard maternal death still takes more than 300,000 lives a year. And, by the way, also to have safe and legal possibility for an abortion is a fundamental right of women. Just very recently, and we've talked about this, and I was in one of the working groups who discussed this, they were fundamentally strengthened, the rights of women, on paper. But it's a start. In September 2015, the heads of state unanimously decided on the sustainability goals, which are universally binding. They are a transformation demand also for all countries, not only for the global south, also for the global north. We have to change. Also, we have to change. And I take goal 3, ensure healthy lives and promote well-being for all at all ages. Goal 5, achieve gender equality and empower all women and girls. Preventing new HIV infections could empower women and girls to protect their own well-being. And goal 10, we discussed that in the working group also, reduce inequality within and among countries. Gender discrimination, the root cause of many inequalities, is linked to higher HIV prevalence. New female-centered tools would help empower women and communities. And it also has been said, empowering women has also got to do with political representation. 23% of parliamentarians in the world are women. And there are just 9 heads of government that are female. And limiting women's access to labor markets is not only unjust, but also costly and detrimental to an economy. And women that are economically independent are more independent in their sexual life and vice versa. What is particularly worrying is the fact that we have to see that young girls are the ones that are most affected by new HIV infections. Girls account for 74% of all new HIV infections among adolescents in South Africa. Every week there are 7,000 new infections. Why? Why is that? Is it a coincidence? The latest UNAIDS report about fighting HIV among women and girls names a series of reasons, and I'll just mention two of them, why girls and women are disproportionately affected by new infections of HIV/AIDS. Men having sex with much younger women. The age of sexual partners is a key factor that contributes to HIV incidence. Early marriages and forced marriages are one, but not at all the only example. In such relationships, not only is there a higher likelihood of older men being already infected, but also of unequal power dynamics within the relationship that will prevent safer sex. If you are dependent on your partner, you will not ask him, why don't you use a condom? That you will not be able to negotiate on that. Harmful social and gender norms, cultural concepts of masculinity encourage men to assume that wives, partners, and daughters are the possession of men. And of course, also transactional sex. Adolescent girls and young women that are less economically well off engage in these relationships for three main reasons: accessing basic needs, increasing their social status, and receiving material expression of love from male partners. So again, there is an asymmetrical power relations. Women who engage in transactional sex are more likely to be HIV positive. Particularly worrisome is the widespread violence against women and girls. As the director of the South African program HATES, Dr. Ramnek Aluvalia, told us in a meeting just some weeks ago with his peer educators in Johannesburg, 1 in 3 girls in South Africa is raped before the age of 21. The higher infection rate of HIV/AIDS among women and girls is not a coincidence or result of biological facts. The higher infection rate of HIV/AIDS among women and girls is a result of discrimination and asymmetries of power. I will never accept the fact that being born with 2 X chromosomes leads to earning less money or leads to not being elected into a parliament, but catching a deadly virus. If that's not a scandal of inequality, then I'm unable to even make one up. Now, where can we start to address this immensely intricate phenomenon? I will name, and we can in the discussion perhaps also explain a bit. There are some initiatives on the micro level which I think are interesting, which I saw myself. For instance, the First Things First in South Africa, with the support of the South African Education and Health Ministry, which has started peer education programs. And the peers in the campuses have proven to have a powerful influence within their own community when engaging towards behavioral change. In mobile service, they offer HIV testing, screening, and referral to treatment, TB and STI testing, cancer screening and referral, family planning education, and provision of contraceptives and condom promotion. It is called a health and wellness program. And I think behind this, and I've met that several times, there is a new thinking. It's less to say, don't. It's more to say, you have to do something for your own wellness and for your own health. And I think this comes in many of the initiatives. A mass media and mobilization program that addresses gender inequality belongs also to this initiative, encouraging young women to draw on their inner strength and power and an issue of rape, sexual violence, dual protection, breast and cervical cancer, STI screening, contraception, and transactional sex. Another initiative is the Future Beats. It's youth development and HIV prevention through radio and social media. The trained journalists that come from the students' movement do it in their own language, in the language of young people. And they give also important leadership roles to young girls, connecting with their way of communicating. And support of the work of the Global Fund. I am an activist to support the Global Fund. I say that because when it was founded in 2001 and 2002 by Kofi Annan, he fought for it, I very much supported this initiative, and the Global Fund, in these 14 years now of its existence, has helped to save 20 million lives. Women and men that can live and work and support their families. But now we are already before a decisive watershed. There has been, thanks to the Canadian government, there has been the replenishment conference just some weeks ago to collect the finances for the next 3 years. And one has to acknowledge, and also our own government has to acknowledge, if the investment is not kept up and even additional finance is mobilized, then we will miss the goal which the heads of state themselves in the UN General Assembly in September 2015 has established as an important sustainable development goal, to end AIDS by the year 2030. And there would be, and that is what they have to get, a serious setback with higher numbers of infections, especially in young girls and women. And also, I think that is important that the CCM procedure, the country coordinating mechanisms, include women, include young people, include NGOs in order to get their ideas forward. Global Fund supported programs are improving the health status of women and girls overall by linking reproductive, maternal, and adolescent health care with programs to treat and fight HIV/AIDS, TB, and malaria. And about 60% of the organizational total investment is directed to women and girls. One possibility with which I will conclude, one possibility is to reduce women's dependency on men in having sex is the dapivirine ring, which is developed by the International Partnership for Microbicides. It's a prevention method. The woman can insert by herself the ring into her vagina, and the monthly dapivirine ring showed promising results in 2 phase 3 clinical trials. It reduced HIV risk by approximately, which is not much, 31% overall, but by up to 56 among women older than 21 who used the ring more consistently. And additional analyses have shown that the product could reduce the HIV risk by 75% or more. Additional data on the ring will be submitted to regulatory approval, meaning that, if granted, first approvals of the ring could potentially come as soon as 2018 in some countries. And the plans go further to have a longer-lasting ring for 3 months, and also in combination with a contraceptive drug. Some women, of course, will want to take a daily ARV oral PrEP pill, while others will prefer a longer-acting HIV ring with or without contraception. Still, and this is my last point, we need behavioral change of men overcoming their imagined dominating role. Role models, positive role models there are important, and we must not stop talking about HIV/AIDS. Silence and the lack of awareness are our number one enemies. And resource and finance matters. We need to continue mobilizing resources to end these diseases and to contribute, along with the Global Fund, saving lives and improving health systems for all in order to defeat these diseases at the latest by 2030. And there is just no path to this goal if we do not empower and strengthen women and girls, end discrimination, and build our common lives as human beings on equality. Thank you very much.
We certainly have a dream here today, the four of us. So feel free to ask questions. I will ask first one. Each of you have worked to develop programs to improve women empowerment. What, in your view, are the criteria of success? What makes a program successful in order to improve women empowerment? Including, the cultural, social structure, how much you have to take that into account?
Well, do they work? First off, you need to have metrics. You really can't measure anything without metrics, so you need to know your population. And it's something that I think we look at very seriously. We've tried two different ways of trying to improve women advancement within the company. We tried a top-down approach, running it from corporate headquarters. But we realized very quickly the needs in one country are not the needs in all countries. And the cultural differences of the way women are appreciated or advanced is very varied. So we've now opted to go and have local initiatives. We share best practices. People can adapt things to the needs of their own country. For instance, in one of Egypt, for instance, where eating family food is very, very important, we have a system whereby women who work can buy the family dinner so that they can go home and be as appreciated as not. That would not be necessary in other countries where it's very easy to go to a traiteur. Having, I would say, childcare. There are some countries where childcare is very prevalent. In France, it's not difficult to have creches. That's not the case in Germany. And we were one of the first companies here to have a creche or a daycare center that we shared with another company at Potsdamer Platz. And it made a big difference for retaining women.
I agree very much that one of the most important factors of success is working with the people who are involved, who are affected themselves. So not designing something from somewhere else and then bringing it down, so to speak, to people. I think it's also important to make the gatekeepers understand. Those who will enable or block the program also need to be supportive. I know when I was working in HIV in Botswana, which is many years ago now, we carried out a study of, if you like, sexual behavior in this country that had this very severe HIV epidemic. But the conventional thinking then was that, oh, this is something that's driven by prostitutes. And you weren't seeing in the bars and on the streets in Gaborone at that time lots of sex workers walking around. There were some. And then we were doing this in the workplace, in public, in government, initially offices. And we found out from the young women in the offices what sort of sexual lives they had, the level of vulnerability. I mean, Botswana is one of these countries that have been affected by the Southern African migrant labor system, so you have particular social structures in place. But we were told by these young professional women that they had a series of male partners, mainly for socioeconomic survival. So a young woman looking very nice would have her car, kids in school. Many women in Botswana at that time were having children without being married, and have a series of men where this one is for school fees, this one is for food, this one is for sustaining the car, this one is for her nice clothes to go to the office with. And when we provided this picture of our nice, calm society to some of the leading people who were resisting, it was an absolute shock to me. It was a shock to them. And we said, okay, we need to work with these young women, help and work with men in these workplaces. It was a very successful program where the men were demanding to be involved both to support the process and to protect their own health. But we needed to get over some resistance with showing some evidence that actually underneath the surface of these very nice, well-organized countries, there are lots of things happening that we don't see that are an absolute danger. So, I think.
Heidemarie?
Well, I agree, and it has also been said, I think, in all the workshops, specifically the workshop I was in, the best thing is, of course, to rely on local initiatives, local groups, specifically women's groups, as an example. And of course, also, I think it is important, that is why, for instance, the Global Fund supported or trained 38,000 women in Ethiopia in order to be, health experts in the country, and also to help in mother and child care, and also in changing gender norms. So I think those initiatives are important. Specifically, I would also say in the Global Fund, it's important that those initiatives play a bigger role, that non-governmental organizations play their role. But it's also governments that have responsibility, and we should hold them accountable because, as I said, they have voted in 1 year ago on those goals, and now they are also responsible, and from both sides, it is important to change.
The speakers truly welcome questions from the audience. I see hands raised there, so let's have a first question from the audience. Please stand up and say your name and from what organization or where you are on your...
Yeah, good afternoon, everyone. My name is Tausif Nauman. I'm from the Institute of Gender in Medicine, Charité, Berlin. I'm wondering, I'm not having really a question, but I really found it interesting, and I'm wondering why is the case that every time I go to the gender-related topic or women-related conference, why there are more representatives of the women's only, and we are missing the men in that part. I think we need I think we are missing one of the point that for this imminent goal, we need to bring the men into the mainstream, which is lacking every time at least from my last experience and observation. Thank you very much.
Excellent question. Go ahead.
It's not for me to decide on it, but I've participated in 2 days before, and I think, and I think, there could have been more representation of women. That is already mildly put it. But I agree, of course, the support of men in all these questions is important, and it should indeed be strengthened. By the way, today is the Day of the Girls. That is also a point. Perhaps it's worthwhile, not only one day for girls, but more days.
Shidi, you want to comment on this? No? Well, certainly we...
Okay, just a question. I'm trying to look around the room and see how many men are here. So in a sense, after all these years, why would men need to be brought? What would make them come? What would make them take the initiative to, and I thank very much the men who are here, to take an interest and play a role and offer their influence, power, resources, authority to this endeavor. So what would it take to achieve that, for this to be spontaneously an interest of men, a passionate interest of men, so that they jump in without waiting to be invited, though I do acknowledge it's only women who are up on the stage. Thank you.
Another question from the audience?
Can you hear me? Yeah. Yes. Hi, my name is Desiree Lichtenstein. I'm from the organization Women in Global Health. We just had a speech or a session on gender responsive governance, and unfortunately there were only 2 men there, but a lot of women. So thank you all for really terrific talks. I would like to discuss a similar question. When we talk about women's empowerment, we most often focus on solutions regarding just women and very seldom talk about the solutions with men. I think you, Minister, talked a bit about that, but I would like to hear more of it. And my question is, even though many of these questions are connected to both men and women and all genders, when we talk about solutions again, we don't see it. The men's part of the solutions there. How can we change that, and how can we make more every gender participate in like solutions? Thank you.
So, who wants to comment? Obviously, we need women and men for the well-being of people and the development on this planet. So, how can this be improved? Do you have comments?
Well,
it's a big question.
Well, first, I think it starts at home, because in the end, I think we have to call out when we see biases. When someone says, no, the girls should study law, the boys should study medicine, or go to business school, I think we have a responsibility in our own families. I come from a family where my grandmother worked as an immigrant to the United States, my mother worked, and my father was a school teacher. So they had probably not a typical relationship at the day, but it's made a difference. I do see in our own company, our CEO, who is the father of a daughter, is very committed to this issue, and very easily we got buy-in. So our women's board, which encourages gender diversity in the group, has 50% men and 50% women. I also see a big difference in younger men. I do see now, at least in my own family and in the people in my team, there's co-parenting is more common than it ever has been. So I think with generations it will change, but I do think we have a responsibility as professional women when we see behaviors that are not appropriate or indicate a bias to call it out. Within our company, it's mandatory for every ExCom member and their teams to have training in unconscious bias, because it's not, we don't see it's overt bias, we see it's more unconscious bias. A woman can't go to work in a foreign country because, oh, what will happen to her children, her family? And those are things that should not be part of the interview process. If you put your hat in the ring because you want to go to India, you want to go work in another country, you should be allowed to do it.
Thank you, Karen, for this very good answer. Another question from the audience.
Much. I'm Dr. Tasdiq, working in Bangladesh in a low-resource setting. Thank you very much for 3 wonderful presentations. I'm inspired and motivated being a man. In line with Tausif, I definitely want to say that next year in World Health Summit 2017, we want to see a male presenter in women empowerment session. And I have actually 2 queries. One is, in our country, like in low-resource settings, sometimes we can see a lot of women are working, women empowerment is happening, and in last month, our Prime Minister received award from UN for women empowerment in New York. But the thing is, in case of science, there is less presentation of women. In case of my organization where I work, ICDDRB, that is one of the largest research institute in Southeast Asia, there you can see only I think 2% of women are in international scientist position. But they're running in the beginning phase of their career, they're running like bird, and they're doing wonderful researches, but somehow in the middle of their career, they're being stopped, and somehow in the international level, they cannot reach. So I want to hear some inspiring suggestions from you so that I can take that to my home to inspire my woman, who is a physician too, so that she can come into that place one day. So, and another thing that is a bit controversial, that sometimes I attend some sessions on women, like a gender awareness workshop in my workplace, and all the things, it becomes like a feministic attitude, and it deviates from the woman empowerment perspective, and being a man, sometimes I feel outcasted. So in case of health, I want to know that how a differentiation can be made where a male can be a proud speaker of woman empowerment, woman health, and just one line that in our low resource settings, sometimes male are, they don't feel good to be a gynecologist. Whenever a male say that, I want to be obstetrician, maybe some problems can be come from the family too. So these things, I know, I want to hear something that how these things can be changed, and that differentiation that can differentiate between feminism and proper gender thing, I think.
Thank you for
Yeah, thank you
your
very much.
questions. There are a few items here. So can we speak about career progression for women, obstacles, and also about professional stereotypes, regarding employment for women or men? So that's what I understood from your question.
Okay, thank you. I couldn't quite catch all of your questions, but I guess career progression has to be promoted and encouraged in different ways. First of all, I think having role models, having mentors, and having male co-workers and supervisors who are supportive as well. I thought the point about unconscious bias is very important, because it's what is communicated to women within the workplace by colleagues and supervisors and bosses that encourages and enables them, yes or no, to try for career progression. They should certainly be enabled in the workplace. And I believe this should be a part of the institutional culture and a required part of the institutional culture. It doesn't happen because people are nice. It will happen because it is required, and there are some, and I'm very pleased to see that in the UN, in WHO certainly, our governing bodies are demanding that we adhere to some standards, and there is a system of monitoring whether we are progressing or not. So as managers and as leaders, we are making much more effort to encourage women and to see that women are improving and progressing within the system. It's also to help in the working conditions, women be able to carry out their multiple roles, both as professionals, as workers, and also to have an enabling environment that will help them deal with, for example, their family responsibilities, which at least in African countries go well beyond what a woman has to do with her husband and children. They often have roles to play in the wider family and have very important roles to play there. I do think, I just want to go back to the issue of males engaging men and support from men, which is required. I think this is very important, and probably much more effort needs to be put into it. But I hope we can neutralize the understanding of the word feminism. I guess I'm in my 60s. I'm from that generation when being a feminist was fine. It was okay. And it's a concern now that suddenly this is becoming some sort of pejorative or problematic notion. I'd like to understand that better. Thank you.
I must say, I love being a feminist, and I don't mind being called a feminist, because for many reasons, and I refer now to the German side, because it's always better to criticize in the country you are in. Isn't it true? We still have a difference of wages, a gap between men and women of 21% in Germany. It's a disgrace, and we have just passed a law which so far is not in action, which tries to end this scandal. So this is one thing. The other thing is, of course, Sanofi, that is wonderful, but the fact is that also we had to try to have a kind of quota system for the big companies, which actually some of them have zero representation in their deciding bodies. And I think, of course, I'm all for empowering men. But on the other hand, the first thing is now to see to it that also in these firms, and perhaps even in banks, by the way, more women would play a role, would have decision possibilities, and also be able to decide on a company's future. And also, that is my experience from the ministry. Women have sometimes a different way of tackling questions and going rather more to solutions than to whatever. And perhaps one last thing, because the colleague said he comes from Bangladesh. Also a question, speaking about women careers. I have been active in supporting the question of transparency in the textile sector. If you have a textile sector which in Bangladesh, in Myanmar, and also in Vietnam, consists practically of more than 90% of young girls working in these factories, then I think we also in Germany could do something about it in having more transparency and supporting, for instance, the work of trade unions in these factories to change the awful living conditions and working conditions.
Thank you. Okay, we have time for 2 more questions, one in the back and one up front. Please go ahead. In the back.
Hi, my name is Mansi Patel. I'm a student from Brookline High School, and I just want to say thank you so much for this informative and inspirational presentation. My fellow classmates and I were wondering why this conference was held at the end when we were trying to raise so much awareness, because it's clearly this is such an important topic.
Well, I'm the incoming international president, so we'll work on this for next year. Thank you for the question. So this is the very young generation asking these questions. Thank you. Another question? Yes. I'm not seeing well who has the microphone. There's one question up front here, I know, in the back.
Should I? Okay. Good evening, everybody. First of all, I want to thank you for your wonderful presentations. Maybe it's somehow embarrassing or like a shame to us to discuss a title like Women Discrimination or Women Rights in the 21st Century. Maybe since 100 years ago, this title is always on the public health conferences. I have a comment and a question. First of all, why are we actually discussing a common problems as a special problems against women discrimination? Maybe like healthcare issues. Many of the countries where were actually mentioned today has healthcare issues on women, men, and children as well. But why are we actually discussing it as a special women problem? Maybe they are just having healthcare issues problems. And why are we actually discussing the symptoms of another causes? So like women discrimination in many countries has just causes in the culture, maybe in the thoughts, in the education. But why aren't you actually discussing the culture itself, the education itself? If just a child grown up in discrimination between men and women, differentiation between the daughter and son, between a man and his wife, I will not wonder to have such an statistical numbers in front of me right now. It's just a cause of a problem. So why are we actually not discussing the causes itself, the culture itself, developing the education itself, instead of discussing the problems which we will discuss in the next, I don't know, maybe 10, 20 years, dreaming of the day that we don't have or we don't need to discuss such a title more in the World Health Summit. Thank you very much.
I don't know if someone wants to comment. We will take the first slide of my talk, if possible, which is a positive and encouraging slide for men and women trying to make this world better. Please go ahead and answer.
I'm a bit provocative, because it's the last minute, it's the Girls' Day, and so perhaps I misunderstood also the question, but if you take maternal death and the number that is connected with giving birth to a child, there you can easily see that the health problem is a woman's problem and a problem of society. And I might be provocative now, but if men were bringing birth to a child in the world, the health system would be the best system, best established, and also well established. I'm completely sure about that. Yeah, that's true.
Okay, we are given. Thank you.
Sorry.
Do you want to comment? We have 10 more minutes. They have allotted us 10 more minutes. So.
Yeah. Okay. I just want to add that I think simply making health services available will not eliminate all of this. I think that even if, say, if I take African countries, even if in some cities, for example, where there are nice university hospitals, where you imagine that people don't have very far to go to reach a clinic and to get into a hospital to be provided with services, we have some of the highest maternal mortality rates in the region, sometimes higher than even people who are far away in rural areas. And some of this is rooted really around some of the issues we were talking about. A woman might be living in a peri-urban, low-income area. It's her socioeconomic status, her ability to make decisions, her ability to negotiate with her mother-in-law to let her go to the clinic now, go to the hospital now, I'm in labor. Her ability to pay if she finds that the social environment around her is not supportive, her ability to say no to having sex with a man without a condom. This has nothing to do with whether health services are there or not. It's around some of these issues. And I think what we're trying to show is some of the factors and some of the determinants of women either being healthy or women not being healthy. It's very important, perhaps. And I thought there were two very good examples given of interventions and actions that can be taken in a very practical way to improve the situation. I think what this data, this analysis of these determinants is what has given rise to the thinking behind these sustainable development goals to show that all of this is interconnected. If we work on health alone and we improve services for health on their own, this is not going to solve all these questions. We have to delve into these socioeconomic, cultural issues. It's true, it's very difficult to change culture. We need to learn how to do it. There were attempts to do that around HIV and AIDS, where we have to acknowledge it's been very much a mixed success, but we are seeing elements of what might make success. And just to end, I do think that the role of men deciding themselves to do something without being coerced or edged or egged along and made to feel defensive in this is extremely important. We have to find good ways to articulate it, I guess. Thank you.
So, one last question up front here.
Thank you for this opportunity, and I'm a journalist from China, and my name is Ni. And nowadays I am paying attention to the female scientist situation in Europe and in Germany, and I find that besides the gender discrimination, there is another problem. Some girls, some female scientists really do a very good job in the academia, but a large part of them just want to quit because there are a lot of barriers for them in the career. And my question is that, what's your opinion of this situation? How can we encourage instead of push those female scientists to go to the leadership? Thank you.
Depending on the country today, professional schools, and in France at least, women are 50% of the people seeking scientific degrees. Medical schools, 50% of them are women. It's incumbent upon us to have a working environment that allows them to succeed.
One of the things we do is we have the ability to work from home. We have part-time work. We also have a very generous maternity leave policy, and we encourage people to come back, and we don't have them lose any, I would say, seniority because they were out 6 to 9 months. And I think companies, at least in our sector, are very open to encouraging female scientists to continue because the education, the amount of work, I do think it's hard today. People think they have to make a choice between being a great mother or being a great professional. I think you can have both, and you have to work in a company that's ready to help you achieve that because there's a period of time in your life when you're of childbearing ages, but not only that, because one of the things we have to be careful, when you're a caregiver, you're not necessarily a woman, the majority are, but you may have obligations at different points in your life where the company can support you. And that's one of the ways to do it, by working for an open-minded company.
Well, any more questions? If not, I see there are many, so we may have to leave it for next year, or you can come and discuss with the speakers. So please join me in applauding our 3 fantastic speakers.